Over 80% of women experience pregnancy and childbirth. We really haven't accounted for that in basic science studies. So many changes have to happen to sustain a healthy pregnancy. The blood volume has to increase. You have to get the nutrients and oxygen to the fetus. The cardiovascular system of the mom has to adapt to that. The body has to grow an entirely new organ, the placenta. All these changes have to happen in pregnancy, and then the baby gets delivered and the placenta goes away, and everything has to kind of find its new normal, and the effects of even a normal pregnancy could be really important for cardiovascular health. Very broadly, we take a female-centered approach to cardiovascular physiology. We want to understand how pregnancy and potential pregnancy complications are affecting female cardiovascular health. We're very interested in blood pressure regulation, how the different organs talk to each other, and how the different cells from those organs can communicate as well. We also have projects related to atherosclerosis and the impact of pregnancy on that as well. We are vascular physiologists, so we can take blood vessels and keep them alive outside the body. We can see how the impact of different risk factors like high cholesterol, high blood pressure, aging, all those things affect the arteries' intrinsic function. We also use ultrasound to look at the stiffness of the arteries. We look at the blood flow to the uterus during pregnancy and how that might be affected by different conditions. We can also measure heart function. We have devices that we can measure blood pressure 24/7, and we can do this prior to pregnancy, during pregnancy, after pregnancy, in various contexts. It's a really powerful tool to understand what's happening to blood pressure. Heart disease is the #1 killer of women, and we really haven't appreciated how it affects women differently. Historically, physiology of males and females was thought to be pretty similar, but the more people looked, the more they found differences, whether that be at the organ level or the tissue level, the cell level. Females have unique things that happen in their lifetime. Pregnancy, menopause, and that affects the cardiovascular system differently. If we can understand the fundamental process in females, how the risk factors affect those fundamental processes, then we could identify new therapeutic targets to help these women that we know are at higher risk of future cardiovascular disease.